Well, I'm Dr. Louis Sullivan, native Atlantan, born here at Grady Hospital in 1933. I'm a physician, graduate of Booker Washington High School here in Atlanta, and of Morehouse College, and a graduate of Boston University School of Medicine. I was born in the depths of the Depression here in Atlanta. My father was a life insurance salesman. I was the second of two boys, and at that time he was not making any money because no one was buying life insurance. People were more concerned about paying rent or putting food on the table, etc. So he was going broke. So he decided that he needed to move from Atlanta to try and find business elsewhere. First moved to Noonan for less than a year, and then on to Albany, Georgia, where he entered into a partnership with a funeral home there, with Poteet Funeral Home. So he went into that business and that partnership, and that lasted for about 2 years. And for reasons that I've never learned, that they didn't get along, so they dissolved that. And my father then moved to Blakely, 58 miles west of Albany. And he established the first black funeral home in Blakely at that time. Up until then, when blacks died, they would have to send either to Albany, 58 miles away to the east, or to Dothan, Alabama, 28 miles to the west, to get a black funeral home service. Or the one white funeral director there would provide services, but they would have to go in the back, or going to the funeral services, the casket would be on the back of a flatbed truck rather than in a hearse. So when my father moved to establish the funeral home there, he was well received. My mother was a school teacher, and she was, of course, there with my father. But my father was also a real social activist. And what I mean by that is this. He established the first chapter of the NAACP in the small town of some 12,000 people in southwest Georgia. He was working to get blacks registered to vote. He was fighting the white primary, the laws in Georgia that did not permit blacks to participate in the primaries. He sued the school system for having inadequate school facilities for black students. He started started the annual celebration of emancipation, January 1st of every year, with speakers and a parade and so forth. And all of this really to really uplift the black community. He was well supported by the blacks in the community, but for all of his activism, my mother, as a school teacher, could never get a job teaching school in Blakely or in Early County. And they lived there 20 years, from 1937, when I was age 4, they moved there, until 1957. So during all that time, my mother, though she had first a bachelor's degree and then later a master's degree in education that she received from Atlanta University, she had to travel to towns and other counties where she would get the job, because this was the only way that the white community could retaliate, because my father was serving the black community here. So my brother Walter, who was a year and a half older than I, my brother Walter and I would go with my mother wherever she was teaching school. That's where we attended school, until Walter was in 6th grade and I was in 5th grade. And they then sent us to Savannah to live with my mother's relatives, because my mother had grown up in Savannah. So most of her family was there. So we went to Savannah for a year to attend schools there, because in those years of segregation, certainly in rural Georgia, schools for blacks were really woefully inadequate in terms of books, equipment, etc. And my folks were strongly committed to my brother Walter and I getting a strong education. So they sent us to Savannah for a year. We lived there, and then the following year, my mother came to Atlanta University to get her master's degree in education, so we came with her. So when I was in 6th grade, I attended schools in Atlanta for the first time. During that year that my mother was here working on a master's degree, she met people and made arrangements for Walter and I subsequently to live with a friend that she had made, Mrs. Maud Brown, where we actually stayed with her subsequently. My mother went back to Blakely after the end of the year, having gotten her master's degree. But Walt and I stayed with Mrs. Brown, and we would go home on holidays, occasional weekends, and of course during the summer. But in essence, from the time I was in 6th grade on through graduation from Booker Washington High School, we attended school here in Atlanta. That was because my parents wanted us to get a strong education. In those years in rural Georgia, certainly in Blakely, there were 2 physicians. They were both white. Again, with the segregation in those years, you'd have to go into a separate waiting room, separate entrance, or around the back to see the doctor. And my parents' way of resisting that, and others in the black community, was that if you had an emergency, they would go be seen there. But if it was not an emergency, they would drive 41 miles south to Bainbridge. The one black doctor in southwest Georgia was Dr. Joseph Griffin. He turned out to be my first role model because when I was about age 5 or 6, while riding in the car with my mother, she was asking my brother and me what we wanted to be when we grew up. And my brother was going to be an undertaker, just like my father. And of course, that was not surprising. I said I wanted to be a doctor. I said, I want to be like Dr. Griffin. And my mother said, Louis, that's fine. You'll be a great doctor. And I really, looking back on that, realized she was giving me really positive reinforcement. And the thing about Dr. Griffin was as follows, that really impressed me greatly. First of all, he was highly respected in the community. People came from all over southwest Georgia to see him. He was obviously very successful. He had built a brick clinic, about a 25-bed facility. He operated on people for appendicitis or for tonsillitis and other things. So he was someone who possessed powers that other people didn't have. He could cure people. When we would go to his clinic, and my father would often provide ambulance services to people in the community, having a funeral home. And so when he would take people down to see Dr. Griffin, he would always ask me, Louis, why don't you go with me and help me? Of course, again, I realized my father recognized that I was impressed by Dr. Griffin, so he was reinforcing that. But you open the door to his clinic, you smelled ether, something strange, pungent, powerful, etc. And he would always be in green scrub suit. And so all of that impressed me. I said, here's someone who's doing something important. People respect him. Financially, he's doing well. And I always liked biology. I was always interested in birds or squirrels or plants, flowers, etc. Really interested in nature and biology. So from those early years, I knew that I wanted to be a doctor. The other things that happened to me during that time was just that my parents, knowing that Blakely was a small town where there were few recreational facilities for black youngsters, my father built a ice cream parlor on the property where we lived. And this was an ice cream parlor that my brother, Walter, and I would operate during the summer when we were home there in Blakely. It turned out to be a very popular place for young people. It turned out to be a gathering place in the community, and not only for teenagers, but also for some adults as well. So they really changed the community and influenced the community greatly. So my parents really provided an example for me and my brother of really people who could work to change the community. So we really were very much impressed by them, and their value system as well impressed us. The time that Walt and I attended school in Atlanta. It was a great time. We had a lot of classmates who were very interesting young people. We lived right across the street from Booker Washington High. We met physicians, black physicians in the community. But Atlanta also was a city that had a lot of successful black people, businessmen. There was Atlanta Life Insurance Company where my father had worked before, and of course I later learned that that was started by Alonzo Herndon, who had really been born a slave, but he then became a barber and then started this burial service, and that developed into Atlanta Life Insurance Company. We found that the homes that blacks had here were really very nice homes. We learned that there was a Mutual Federal Savings and Loan, which really helped blacks get mortgages at a time around the country when blacks would have difficulty getting mortgages. There was Atlanta University Center here with the various black colleges here, Morehouse College, Spelman, Clark, Morris Brown, Atlanta University. And so this was a community, city that had a vibrant black community, a lot of people who were very successful. So we were very impressed by that. And so the influence that my parents had on us and my teachers in high school, because they always were very dedicated to us, wanted us to learn everything. They would stimulate us, they would challenge us. I remember many of my high school teachers, Mr. Martin, my geometry teacher, would challenge the class and really inspire us to work very hard. So when it came time, when I graduated from high school, and I was class president and also class salutatorian, so I had done well academically. My mother had graduated from Clark College, and my brother, who was a year ahead of me, had enrolled in Clark College. So I was expected to go to Clark. But my friends were going to Morehouse. And I really wanted to go with my friends to Morehouse. That started a little family discussion because my church for my family was a Methodist church there. And of course, these schools in the Atlanta University Center had been started by religious affiliations. They had long since become independent, but they still had some relationships with these denominations. Morehouse had been started by the Baptists. So when I told my parents I wanted to go to Morehouse, my father said, "Morehouse, that's a Baptist school." I said, "Well, gee, yes, it was founded by the Baptists, but it became independent a long time ago." He said, "Well, I don't know." And so we had this family discussion, and so my mother intervened and said, "Well, let's think about that. So Morehouse is a fine school. If he wants to go there, there's nothing wrong with that." So that was the end of that. So I went to Morehouse. That was a great decision for me because, as you know, Morehouse College really has the distinction of having a number of successful blacks, not only here in Atlanta, but around the country, who attended there. And since I was interested in medicine, I knew that Morehouse had a strong pre-medical program. But of course, some of our most famous graduate, of course, is Martin Luther King Jr. He finished in 1948. I entered Morehouse in 1950, so I really didn't get to know him until many years later. I had just met him once in Boston, in fact. But in addition to Martin Luther King Jr., there were people such as T.M. Alexander, who was a prominent black businessman, had a real estate insurance company here in Atlanta. There were ministers around the country who had graduated from Morehouse. But most important was Morehouse's president, Dr. Benjamin Mays. Dr. Mays was someone whose own life story was really inspirational. He grew up in rural South Carolina, a town called 96, because Highway 96 ran through there. Yeah. And he didn't go to school a full year when he was growing up in the early part of the 20th century. But he went to Maine to Bates College and was the one black in his class. And he finished, I think, in 1906 as valedictorian in his class at Bates College. As president of Morehouse, he had received a PhD in philosophy and religion from the University of Chicago. He was an eloquent speaker. He urged the students to aim high, don't take shortcuts. He would say things such as, whatever you choose to do in life, you should do it so well so that no man living or no man dead and no man yet to be could do it better. He said, if you commit yourself to that, when they're looking for someone in your field, whether it's law or business or medicine or architecture or engineering, when they're looking for someone there, they will have to consider you. So you may not get the job, but it should not be because you're not qualified. And that really, we took seriously as students, because we wanted to be like Dr. Mays. He was not only eloquent, the speaker, but he was always walked with grace and was proud and erect, was well-dressed, was tremendously courteous, deferential to people. And so he was really quite a role model. He was really like a second father to us. And as you know, Morehouse was and still is an all-male school. Sullivan is across the street, our companion institutions, all female, both independent schools, but there are a lot of relationships between the two schools. But that was the kind of influence that we had there. So I worked hard at Morehouse, and I loved being challenged. So again, I did well. I finished second in my class, and we were encouraged by some of our faculty, as well as in career counseling sessions, to really go to apply wherever we wanted to go. So we were encouraged, for example, for a pre-medical program, to apply to medical schools all over the country. I finished Morehouse in 1954. That was the year of Brown versus Board of Education decision. Most blacks up until that time attended the two predominantly black medical schools, Howard in Washington and Meharry in Nashville. But in those years, there was a lot of encouragement in the early 50s for blacks to really apply to Michigan, to Harvard, to Stanford, et cetera. So I applied to several schools, Boston University, University of Rochester, School of Medicine, University of Michigan, et cetera. And I really had no idea if I would be accepted. So when I applied to Boston University, about a month later, I received a letter acknowledging my application and saying they would like for me to be interviewed by an alumnus of Boston University, who was a physician, School of Medicine, who was a physician here in downtown Atlanta. So I went down for my interview and had the interview, and while the doctor was courteous, somehow he just didn't seem to be very interested. And so I thought, well, gosh, I'm not sure how I'm going to do here. And so he thanked me for coming, and so he said I'd be hearing from the medical school. And I said, oh my goodness, I wonder if I will be invited for an interview or if I'll be rejected. Well, I got about 3 weeks later a letter from Boston University, and I opened it saying, gee, I hope this is not a letter of rejection. I hope I get invited for an interview. Well, I opened the letter. It was a letter of acceptance. They had accepted me without even going to the medical school to Boston for an interview. So I was elated. So I was the first Morehouse graduate to go to Boston University School of Medicine. And so that fall in September of 1954, when I went to Boston, that was the first time it was really living in a non-segregated environment. I'd heard so much of Boston and read so much about Boston, its prominence in the Revolutionary War, and Paul Revere's ride, and the Lexington Minutemen, and the Tea Party incident in Boston Harbor. Crispus Attucks was a black American killed in the Revolutionary War, the first black to die. So there was so much history there. And, of course, in my class at Boston University, my classmates had finished places like Harvard and Princeton and Columbia and Amherst and Middlebury, all these places that I'd heard about. And of course, my classmates, when they met me, and I was the one black in the class, would say, oh, yeah, it's where are you from? I said, well, I'm a graduate of Morehouse College. So, oh, Morehead, yes, great school. I said, no, not Morehead, Morehouse. Said, oh, Morehouse, well, where's that? So I was wondering, well, how am I going to do here? And so I was very much aware, first Morehouse alumnus to go to Boston University School of Medicine, only black in my class. how am I going to do? Here are all these guys from these schools I've always heard about, the Ivy League, etc. So I hope I don't embarrass myself. I hope I represent my family. I hope I represent Morehouse well. But I was nervous. And of course, going to medical school represented another change, because my classmates were all very smart. They had finished top in their class, wherever they had gone. So I said, well, this is, while I had done well at Morehouse, and I had really very bright classmates at Morehouse who did very well, I said, well, now here, this is another thing. So make a long story short, we had our first examination in anatomy 3 weeks after I'd started, and I got one of the top scores. So I relaxed. I then knew my preparation was just as good as that of my classmates. And I had a great experience at Boston University, both academically and socially. I found my classmates accepted me, and really after the first month or so, I forgot I was black. And it really was, my classmates were Barry or Pat or Regina, etc. We would work together in anatomy or physiology, etc. And I was elected class president my second year, so I served as class president there. Great learning experience. Medical school, I found, of course, I could do the work. It was just, there was so much of it. The challenge wasn't the difficulty or complexity of the concepts. That wasn't the issue. It's just so much information to master coming at you so fast. So I did well, finished second in my class at Boston University. And by this time, I knew that I wanted to be an internist, go into internal medicine as a field. I ever heard of internal medicine when I entered medical school. I was just thinking of general practice, etc. But I learned a lot about medicine while I was in medical school. So I wanted to be an internist, because internists really are the diagnosticians. They're the people who are supposed to have the most comprehensive knowledge to solve problems, to not only make the diagnoses, but really manage complex medical problems. So that appealed to me. Well, in deciding on where I wanted to go for an internship, I again decided I was going to apply to top places. So I applied to a number of places in Boston and New York, including New York Hospital. New York Hospital, this is now in the winter of 1957, because I finished in 1958. I went down to Cornell Medical Center, and in 1958, there had never been a black intern at Cornell Medical Center. So here again, I was really going into a situation where I didn't know what would happen. So when I went in for my interview that morning, I remember the doctor who interviewed me, Marv Schlesinger, the gastroenterologist. Had a great interview with him. He asked me a lot of questions. We talked what I wanted to do and why, and what my experience as a medical student had been, and so forth. So I answered. So at the end of my interview, he said, well, now, what are your plans for today? I said, well, I have an interview at Columbia this afternoon. He said, well, look, if you can stay around maybe for an hour, I'd like to see if I can get you in to see the chairman of the department. Well, I knew, well, gosh, I guess I passed the screen. So now things changed, because I really was going through the motions, really preparing really to be turned down. There'd never been a black intern there. They'd never had a Boston University graduate there either. So Cornell was really one of the elite schools. So I was thinking, gosh, maybe there's a chance I might get in here. At any rate, about 45 minutes later, I was shown into the office of the chairman of medicine, Dr. Hugh Luckey. So I went in, and as I went in, he walked over to meet me. He was about 6 feet tall, but very stocky. Had sort of a florid, reddish complexion. And when he said, "Hi, Louis, nice to meet you," he had the biggest Southern accent. I said, "Oh my goodness." I said, well, this is, it's like, why are they doing this to me? I'm not going to get. So I sat down. I had the interview with him about 15 minutes. And so he said, well, Lou, under the intern matching program that we participate in, like other hospitals around the country, we're not supposed to indicate to candidates how they stand in our ranking, but I just hope you know that we're interested in you. I said, wow. Now, that, and I was accepted there. That was a lesson to me, because I had made the automatic assumption that here's this Southerner, here I was black, that I'd never get in. Well, I was accepted. And when I started in July 1st of '58, we had a meeting with the departmental chairman and my fellow interns. There were 16 of us. I was, again, the one black in the group. And at New York Hospital, Cornell, I would say that, as was the case at Boston University, I was well accepted and really did not have, I had only one incident during the, I was there for 2 years, internship and year of residency. Only one incident with a patient who objected to me seeing them. Well, what happened when I got started, I was assigned to the busiest ward in the hospital. That was great because I learned a lot. And so I was very busy. And of course, each one of these times, there was the level of energy, the concentration, the commitment seemed to be even higher. But I adjusted, and I was doing well. I'd been there just about 2 weeks, and the head nurse came up to me one morning and says, Dr. Lucky would like to see you in his office as soon as you can get down. I said, uh-oh, what's happened? What have I done wrong? So I went down, and so he had me sit down and says, how are you doing? And I said, fine. Having any problems? I said, no. Anybody giving you any trouble? No. Learning anything? Oh, yes, yes. He saw I was very tense because I was waiting for the hammer to drop, what I'd done. He said, Lou, first of all, let me say, you're our first black intern. And I'm from Tennessee. I've been here in New York for 13 years, and people here in New York think all Southerners think alike. But I want you to know I intend for you to have a good experience and learn everything you can, because I want you to be successful. So if anybody gives you any problem, I don't care who it is, doctor or patient, you come directly to me. And so, again, that surprised me, and that relieved me. And so, again, that taught me a lesson that in the same way that blacks are often stereotyped by whites, blacks can stereotype themselves. So that was a lesson to me, to not be judgmental of people automatically. So, anyway, I was there 2 years, had a tremendous learning experience. Great faculty, great physicians, my fellow interns also. We learned a lot from each other. So that was a tremendous learning experience for me. The one incident I had was on a Sunday afternoon, in my second year, when I was a first-year resident. I was very busy. In the late afternoon, I think I had admitted 5 patients to the hospital. That was a lot of work with each one of them. So I was called and said there was another patient on the private service who had been admitted by one of the high admitters to the hospital, Dr. Faulkner, who had a large practice. So I went up to see the patient. So I walked in the room. He looked at me and said, "You get out of here." And so by this time, I'm tired. I've been working. And we really didn't like the house staff or the interns. We didn't like the private service anyway, because these was really not our patients. These were the private physicians' patients. And what we were doing is simply doing the evaluation, writing up the charts and so forth. They would really have the orders, so we really felt that we were just kind of supporting services. Really, our input was not really decision-making in terms of that. So in a sense, we never really liked the private service, whereas the public service, we really were more in charge, and we learned. So when the patient said that, I said, well, that's fine by me. And so I walked out. I went, and this was Sunday afternoon. I called Dr. Lucky. He had given me his phone number. I said, Dr. Lucky, there's a patient of Dr. Faulkner's here who doesn't want me to examine him. He says, oh, really? He says, let me talk to the head nurse and talk to her. Well, within 10 minutes, that patient was being wheeled out of the hospital. And so here was the chief of medicine really taking one of our high admitted patients, one of our very influential physicians, and he was discharged. Lucky wasn't going to stand for that. So that really showed me that Lucky was a man of his word here. So, and he and I became really great friends there. So, at any rate, I went back to Boston after 2 years at New York Hospital and did training in hematology at the Harvard service at Boston City Hospital. Because by that time, I learned so much about medicine. I was attracted to hematology, studying blood diseases, leukemia, anemias, bleeding disorders, etc. And I knew that I wanted to not only become a hematologist, but to do research in hematology and serve on the faculty. So I did work at Boston City Hospital at the Thorndike Laboratory, which was a very prestigious appointment. And so, again, I was lucky to get that appointment because the chief of the unit there was Dr. William Castle. He had done work back in the 30s for which a lot of us felt he should have got the Nobel Prize. He didn't, but the work was very important. He showed the mechanism by which vitamin B12 is absorbed by the gut, and that was important in terms of a form of anemia called pernicious anemia, which develops when you have a deficiency of vitamin B12. That's because for people who develop pernicious anemia, their gut loses the ability to absorb vitamin B12. And so Castle had done the work to show why this happened. And he showed that there was a substance in gastric juice, subsequently shown to be a glycoprotein, that binds to B12 that's in the food, primarily in meats, etc., and then transports the B12 down to the lower part of the intestine where it's absorbed. But people with pernicious anemia lose the ability to produce that glycoprotein, so therefore the B12 is not absorbed, just passes right through them. So he was really a brilliant researcher. He had built a strong research unit there, and others before him who had directed the laboratory. So again, I had a great experience there. And I did some research there where perhaps the most significant research was work to show that alcohol in amounts consumed by heavy drinkers could suppress the production of blood cells by the bone marrow. That was a new finding, required study of patients on a metabolic ward, and resulted in not only a publication in a prestigious journal, the Journal of Clinical Investigation, but I was invited to present the paper at an annual research meeting of the American Society for Clinical Investigation. So that really is how my research career started. And when I finished my fellowship there after 3 years at the Thorndike, I was recruited to Seton Hall School of Medicine on their faculty, which is then in Jersey City, New Jersey. I was there for 2 years, and then I was invited back to Boston University to serve on the faculty there. So that opportunity that I had working with Bill Castle and the people in that unit who were brilliant researchers, Jim Yondell, who studied hemolytic anemias, anemias where the red cells are destroyed prematurely when they're still young. My immediate mentor was Victor Herbert, who did a lot of work on folic acid deficiency because they have a similar kind of anemia that can develop if you're deficient in folic acid, which is another one of the B vitamins. And my fellow my colleagues who are also hematology research fellows who subsequently became professors in medical schools in Minnesota and in Wisconsin and elsewhere. So that was a tremendous environment. So all along, I was really fortunate to be in environments that were encouraging, that were challenging, that were inspiring, and also supportive there. The other thing that I should point out is when I went to Boston for the first time, I met a young lady who also had come down to Boston to go to Northeastern University. Her name was Eva Sullivan, but her friends called her Ginger because she didn't drink. When she go out with friends, where they would order various wine or whiskey, etc., she would always order ginger ale. So her nickname was Ginger. So I met her because I hadn't known anyone in Boston at the time, but met her through members of my college fraternity, which is the Alpha fraternity, because when I went to Boston, I looked up the Alpha chapter there to get to know people there. So they were very supportive in getting to tell me all about Boston, making sure that I met people. So I met Ginger. And of course, the interesting thing about her coming to Boston at the same time. She came from Pittsfield, with the very western part of the state. People in Pittsfield looked upon Boston as a city full of temptations, vice, corruption, etc. So her mother sat her down when she was getting ready to go off to college to tell her how to conduct herself in Boston, etc. And so Ginger sat there, listened, and when Ginger thought her mother was finished, she stood up to leave. Her mother said, "No, sit down. I haven't finished yet." Says, "I have one more thing." Says, "If you don't remember anything else I say to you, you remember this one thing. So when you go down to Boston, don't get mixed up with any of those Southern boys." So I had a mother to thank for that. And of course, I later learned the reason for that advice was somehow in her earlier life, her mother had met some guy from Birmingham who turned out to be really a rotten guy. And so her mother concluded all these Southern guys are bad. Well, because her mother told her that, Ginger had to find out, what is it about those Southern boys? She didn't give her any reasons, just stay away from them. Well, we met, and 2 weeks after I was in Boston, we were going out for a date. So we really hit it off. She played tennis. I had always heard about the New England foliage, how colorful it was and so forth. So I, perhaps on our second day, said, "Would you like to go on a foliage tour?" So she looked at me in the strangest way. Because later learned, for her, what's so special about this? I mean, she had grown up every year with the colors, etc. She didn't have to go off on any trip to see the foliage. So this was just a strange thing. But fortunately, she agreed. So we drove up into New Hampshire in early October, and it was very nice. And so it's a nice day trip there. So, make a long story short, we really hit it off very well, and really, I knew this was a person for me. And we actually got married my sophomore year in medical school. And Ginger was a student at Northeastern, and so we were both students. But this really went very well. I have 3 children. My oldest son Paul was born when I was a senior medical student, and he is now a physician in Dallas, Texas. He's a radiologist. Then a second child, my daughter, Shanta, was born while I was a fellow at the Thorndike Laboratory there. And my other third child, my son Halstead, was born when I was on the faculty at Boston University in 1968. So all 3 of my children were born in Boston at different phases in my career. But when I was invited back on the faculty at Boston University in 1966, having graduated in 1958, I was very pleased because I was really returning to my medical home at Boston University. And so I was, again, the first black full-time faculty that they had. And as a student, I had really had such a tremendous experience, both academically and socially. I really was committed to the institution. So I was very pleased there. I developed a hematology service for Boston University at Boston City Hospital, because before 1966, the hematology activities at Boston City Hospital were managed by Harvard Medical School, where I'd done my training, and also Tufts Medical School had a hematology service there. There were 3 medical schools in Boston, Harvard, BU, and Tufts, and they all were there working at Boston City Hospital in a usually cooperative fashion. So I developed the service for BU there, and again, as a member of the faculty, had a great experience. And the other thing that happened was this: in the spring of '68, I was on the faculty there. That was the time when Martin Luther King was assassinated. And like other places all around the country, this was such a shocking thing. It really caused us to really sort of take stock at BU Medical School, as well as the rest of the university. Now, the medical school is over by Boston City Hospital, away from the main university. But when I was a student at BU Medical School, as I mentioned, I was the one black in my class. there were only 3 in the whole medical school. There was a black student in the 3rd year class and one in the 4th year class, none in the class immediately ahead of me. There were a few of us, but again, we all had a good experience. In 1968, 10 years after I'd graduated, when we were assessing ourselves, I noticed that there were 7 black students. And I said, well, you know, 7 is better than 3, but still not that much better. So as a member of the faculty there and as a graduate of the university, I said, we need to really work to recruit more black students here because we have a shortage of black doctors. I've had a great experience here. This is a great place, et cetera. So we organized an effort. There were about 10 faculty, the others were white, who all agreed we really ought to do better here. So we raised money, talked to the dean of the medical school at the time, who happened to be a hematologist, and I had known him when he was a hematologist. He came down from Dartmouth, Frank Ebow. He had been chief of hematology at Dartmouth Medical School before he became dean at BU. So I went in to see him as a member of the faculty and said, you know, Frank, several of us have decided we really would like to see more black students here, and, you know, would you work with us? He said, well, Lou, I agree with you. He says, but we don't have any money. I said, well, look, we want to raise the money. And so he said, well, fine, I'll work with you on that. Make a long story short, we decided that we would work to recruit pre-medical students to come to Boston that fall. We decided Thanksgiving weekend would be a good time for it, to introduce them to the medical school, say, apply here, have your friends apply. Well, by mid-September, this seemed to be going well. We had contacted 24 black colleges, not only Morehouse and Spelman, but other places, Jackson State in Mississippi and Tougaloo and other places. So we got a good response. So, you know, at one of our meetings and planning for this was that, you know, this is looking good, but we're going to have 24 students coming up. We were talking about the medical school. What if all of them are qualified? Can we take 24 students? They probably need financial support. So we said, gosh, that would be a shame if we really have that happen and we're not able to really offer them the kind of support they would need. So we said, well, let's open this up and invite the other medical schools here. So we ended up with this becoming a New England medical schools event, where we had not only Harvard and Tufts there in Boston with us, Brown University joined with us, University of Massachusetts School of Medicine, Dartmouth, and Vermont. So we had all of the medical schools in New England to participate, except for the 2 in Connecticut, Yale and the University of Connecticut, which was a young school, didn't participate. They were more oriented, aligned with schools in New York than us. But we ended up with this recruitment weekend where we had faculty from each of these schools there. We were talking about medicine as a career opportunity, and we were saying how we were interested in training more black physicians, and we'd like to have them consider our schools, and et cetera. And then after the morning session, we would have an afternoon where each school had a room there for the students to rotate through. So all 24 students really had a chance to have individual discussions with people from the schools. So it ended up that the following year, in September of '69, Harvard, for example, had 2 black students in their freshman class in 1968. '69, they had 9. Boston University had 7. Every school that participated except the University of Vermont, every school had more black students. And Vermont, it wasn't their fault. Actually, Vermont had a black faculty. I remember him, Larry McCrory, who came down. He was chairman of their Department of Physiology. They tried to recruit students, but the students really thought that Vermont was the North Pole. So they were not interested in Vermont. And that was too bad, because Larry McCrory and his colleagues were really so disappointed to them. But that was really the response that we had. And of course, this is part of a larger response all around the country, because you may remember a lot of schools really, as a result of that shocking thing, really sort of took assessment. So I was very proud of that as a member of the faculty at BU, because I thought over the years, well, I came to medical school with the intention I was going to go back to rural Georgia, and I was going to be like Doc Griffin. Now here I am. I'm a faculty member, I'm a researcher, and while I'm enjoying what I'm doing, and I think it's important, this is so different from what I had planned. So something like this, to me, was not only to address what we saw as a societal problem, this also would help to really make happen the things that really I had in mind when I went to medical school. So, but one thing led to another, and there was a period of expansion of medical schools that occurred in the country, primarily in the second half of the 20th century. Because in the mid-50s, there were predictions of a shortage of doctors, that we need to have more doctors. So the federal government, primarily with funds given by the Department of Health and Human Services, gave funds to develop new medical schools, as well as to expand the class size of existing schools. And so starting in 1956, from 1956 to 1981, we opened in the country 47 new medical schools. That was tremendous, because up until the mid-50s, we had 80 medical schools around the country. So by 1981, one of every 3 medical schools in the country had been formed in the previous 25 years. Well, Morehouse School of Medicine was one of those 47 new schools. And the way that happened was this. In the late 60s, the Georgia Health Department looked at health manpower here in the state, and they formed a committee co-chaired by a white physician, Rhodes Haverty, who at that time was Dean of the School of Allied Health at Georgia State University, and Louis Brown, a black physician who was a practitioner here, who was president of the Georgia State Medical Association, which is the Association of Black Physicians in the state. They co-chaired this committee that issued its report in 1969. It pointed out that the health of Georgians was below the national average. Higher death rates from cancer, shorter life expectancy, stroke, heart disease, other conditions, etc. They also noted that Georgia had 28% of its citizens were African American, but only 2% of the physicians were African American. They also noted that the 2 medical schools in the state, Medical College of Georgia and Emory University, that there were more students, Georgians, going to medical school than was the capacity of the 2 medical schools in the state. So in fact, they noted that Georgia ranked 38 out of the 50 states in physicians per capita. And so, and many small communities had no physician at all. And so they said, well, Georgia needs to increase its number of physicians, and there are programs, federal programs now that would support that. So they issued this report, and then Louis Brown brought this report to the presidents of the Atlanta University Center schools, because the Atlanta University Center at that time consisted of 6 institutions, 4 colleges, Morehouse, Spelman, Clark, Morris Brown, and then the Atlanta University with the graduate school, then the School of Theology, the Interdenominational Theological Center. While these schools were independent, had their own campuses, students, faculty, trustees, etc., they were all, over the years, had really, by design, become one large mega campus here. So while there was a center, which really dated back to 1928, there was a lot of cooperation among the schools. So Louis Brown came to the meeting of the Council of Presidents, who met once a month, to urge that they consider medical school, taking this report with them. And so what he said was this. He said, all over the country we have a shortage of black doctors. We need more doctors. Here in Georgia, this is particularly bad. Here's this report done by the committee of the Georgia Health Department here, and said if there's any place in the country that really has the capacity and the strength to start a medical school, it is Atlanta University Center. He said there's no other place in the country that has these resources. Well, the rules of the Atlanta University Center that date back to 1928 were as follows: that Atlanta University was a graduate university, and under the affiliation agreements would operate graduate and professional programs. The colleges would operate undergraduate programs. So Atlanta University was the institution that would be the one would look to for this. Atlanta University wasn't interested in that because they saw medical schools as troublesome, expensive institutions. Their faculties have big egos, their salaries are high, their laboratories are large, and many universities with medical schools would say, well, gosh, we have 8 or 10 colleges here, and the medical school takes half the budget, et cetera. So Tom Jarrett, who was president of Atlanta University at the time, who was had been an English professor, really wanted no part of this. He saw this as really an impossible thing to do. There had not been a new black medical school founded in the United States in the 20th century. Howard and Meharry, the 2 black medical schools, were founded in the 19th century. Howard opened in 1868 in Washington and Meharry in 1876 in Nashville. There had been 5 other black medical schools that were founded in the latter part of the 19th century, but the Flexner Report that was issued in 1910 that was very critical of the quality of medical education in the early part of the century in the U.S. Really, there were a lot of medical schools, white and black, who closed. There had been 5 medical schools in Atlanta in the early part of the 19th century. The Atlanta Medical College, the Atlanta School of Medicine, there was the College of Physicians and Surgeons, et cetera. Well, of those schools, 3 of those schools closed. The 4th school, the Atlanta School of Medicine, merged in 1912 with the Atlanta Medical College, and then in 1914 became affiliated with Emory University. So that's Emory Medical School today. Flexner felt that the Medical College of Georgia in Augusta was too far away from the parent university in Athens for the university to exercise what he called academic discipline. He recommended that that school be closed. That didn't happen. The legislature provided more funding and beefed up the school. But around the country, there was this tremendous response to the Flexner Report. Flexner had been supported by the Carnegie Foundation that was concerned about the quality of medical education because we really had a lot of proprietary medical schools, almost diploma mills. You didn't even have to have a high school diploma to enter medical school in the early part of the 20th century. And many of these schools were owned by physicians who really did this for income. The curriculum was not standardized. There were no accrediting bodies, et cetera. So the Flexner Report started a whole chain of events that changed medicine. But 5 of the black medical schools that existed at the beginning of the 20th century closed by 1925. There was one at Shaw University in Raleigh, North Carolina. There was one in Louisville, the Louisville National Medical School in Kentucky, one in New Orleans, one in Memphis, another in Chattanooga. So coming back to the second half of the 20th century, with the expansion of medical education, the idea of forming a black medical school was a real challenge because everyone knew medical schools are expensive, difficult operations, et cetera. So when Tom Jarrett was presented this idea, he went to his trustees and formed a feasibility committee. That committee issued its report in April of 1971, and they said this is not something that Atlanta University is equipped to do. So using that report, the trustees of Atlanta University voted not to proceed. And that was important for Jarrett because Louis Brown and the other black physicians and the white physicians, with Rhodes Haverty supporting this idea, were really pushing for this. But with this feasibility study, then the trustees voted not to proceed. At that meeting was Hugh Gloster, president of Morehouse College, because dating back to the affiliation agreement that, between Morehouse, Spelman, and Atlanta University in 1928, the presidents of these schools sat in on each other's trustees meetings because of their relationship there. So at that meeting, when they voted, Hugh Gloucester asked if he might make a comment, so he was permitted. So he said, now that you've voted, I'd like to state that Morehouse College has been following this, and we have an interest here. We would like to pursue this, so now that you've decided that it's not feasible, would there be any objection to Morehouse College doing this? There was none. So he formed his own committee at Morehouse College and obtained funds from the federal government to do a feasibility study in 1972. That was carried out by 3 faculty at Morehouse College, Joseph Gales, professor of chemistry, Tom Norris, chairman of biology, and Alice Green, who's the director of development there, along with consultation by Dr. William Bennett of the Bureau of Health Manpower in Washington. They worked with them. To make a long story short, they looked at this over a period of a year, and they determined that it was feasible and was needed. And they pointed out all these statistics, the shortage of black physicians, the poor health status of blacks, et cetera, the fact that schools were opening all over the country and there was a demand, and Georgia really was among the states that had a great demand. So they said, this we should do. So they formed a committee after the feasibility study was reported. They formed a committee of Morehouse College alumni who were physicians in academic medicine. So I was invited to be a member of that committee. This was in 1973. So I joined this committee coming from Boston, and I had some questions myself. I said, now, how is Morehouse going to start a medical school? Because one of the things that happened when I was a student at Boston University School of Medicine, 54 to 58, there was some tensions between the medical school and Boston University, so much so that our dean, Jim Faulkner, had actually, with the support of the faculty, explored separating from Boston University and affiliating with another institution. So he talked with people at MIT, at Princeton, Mount Sinai Hospital in New York, and all of them said, we're not interested. And I understand he was told by people at Princeton that saying, well, you know, if we were interested in medical school, we would have started a medical school a long time ago, because, of course, Princeton being one of the wealthier universities, et cetera. But they had just decided that they were not interested. So that separation never occurred at Boston University. Well, fast forward back to the early 70s here at Morehouse College, things like this were in the background, which really made Tom Jarrett at Atlanta University very cautious. But Hugh Gloucester was very interested. But Morehouse trustees and some of the alumni, including myself, were saying, well, now, this is a high-risk venture, and really, the college has been so successful. Why risk the college here? Because if this goes bad, it might take the college under. Well, serving in this committee over the course of a year, I was turned around completely. I thought this was exciting, that Morehouse could do it. We had a strong pre-medical program, and I should have mentioned there were 60 in my graduating class from Morehouse in 1954. 20 of us were pre-med. 1/3 of us were pre-med students. 18 of us went to medical school the next year, and the other 2 went to dental school. So in addition to Howard and Meharry, I had gone to Boston University. One of my classmates, Perry Henderson, went to Case Western Reserve in Cleveland. Hank Foster went to the University of Arkansas School of Medicine, because interestingly enough, in 1954, Arkansas was admitting its 3rd black student prior to Brown versus Board of Education. So Hank Foster went to University of Arkansas. Bill Jackson went to University of Illinois. So we had done well, and historically Morehouse had always trained a lot of its students who were successful in getting into medical school, et cetera. So as a member of this committee in 73, 74, we said there's a need. This is an institution that can do it. And Hugh Gloucester, the president of the college, was really deeply committed to it. So they started the recruitment for a dean. And of course, I went back to Boston, and after a couple of weeks, I thought of a number of people I thought could serve as dean. I sent down this list of names we've been asked to do by Joe Gales. I had 11 people I had identified around the country. So Joe called me about, I guess, 10 days later, and said, Lou, thanks very much for your list. We were very impressed by it, but you know, we were a little surprised and a little disappointed that you sent us an incomplete list. I said, Joe, what the hell are you talking about? I sent you. Then I said, I interrupted myself. I said, oh, no, wait a minute. Now, if you're saying that I should be, I said, no, I'm not the man. I said, look, I'm a researcher. I'm very happy doing what I'm doing. My wife is from Massachusetts. I have 3 children, all born here in Massachusetts. And I don't want to be a dean. I'm involved in my teaching and my research. Deans have to do a lot of fundraising and administrative things, and I haven't had any experience in it. He said, well, you know, we thought this would be maybe a reason in your thought. But, you know, in September, in about a month from now, our committee is having a meeting in New York in conjunction with the trustees meeting in New York. And we were wondering, would you be willing to come down, not as a candidate, but really as a consultant, because you have a lot of good ideas. We'd like to really have you share with us about this the medical school we'd like to develop. So I said, okay, Joe, now, as long as it's clear, I'm not a candidate. I'll be happy to come down as a consultant, etc. Well, that was a slippery slope, because what was to be a 2-hour luncheon meeting with members of the committee turned out to be about a 4-hour discussion. And in that meeting was not only Hugh Gloucester, the president of the college. That's when I first met him. And then there was Arthur Richardson, dean at Emory University School of Medicine, Emory was supporting us in this effort. Pierre Galletti, who was vice president for biology and medicine at Brown. Pierre had been at Emory before becoming dean at Brown University, so he was part of the committee that was working with them. Then Bill Bennett from the Bureau of Health Manpower there, and some other Morehouse trustees. I guess there were about 10 there. And so, since I was not a candidate, I didn't hold back. They would raise some question. I'd say, well, I think that's a good idea. Or something. So, no, I definitely don't think this. So it was really free-wheeling. So Ginger had driven down with me. In mid-September, we'd driven down on the Merritt Parkway. And of course, the fall color had developed. And I really, you know, by that time, I'd become a New Englander. So I was really looking forward to the fall colors. So Ginger had ridden down with me, and she visited with friends in the city while I was having this luncheon meeting. She came back at 2:30, called up to the room, and I said, darling, I'm sorry, we're in the midst of something. Could you come back in an hour? So she said, fine. So then at 3:30, she came back. I said, darling, I'm sorry, maybe in a half hour. So at any rate, we had this intense discussion. So at the end of this time, Hugh Gloucester then said, well, you know, Brother Sullivan, he always called, he was an alumnus. He was the first alumnus to be president of the college. And he always referred to other alumni as brothers. Brother Sullivan, first of all, thank you for coming down and spending this time with us. Your insights are very important, very helpful to us. And I find them very stimulating. And I can't speak for the committee, but I just want you to know, I think you're the man we need for this job. And so I hope that as you drive back to Boston, you think about that, because you could do your alma mater a great service, and you could do an important thing if you were to agree to head this up. Well, driving back up to Boston, after about 20 minutes, my wife Ginger says, well, aren't you going to tell me what happened? So I said, well, you think you could consider the possibility of living in Atlanta? So she said, I knew it. I knew it. So Ginger had never lived outside of Massachusetts. Well, she had lived with me in New Jersey when I was on the faculty at Seton Hall from 64 to 66. But at any rate, she said, I knew that this would happen and they would want you. So, make a long story short, at the end of that interview down there, I talked myself into a job because I found this very exciting. It's going to be a shift in career. I knew I'd be leaving my research career behind because of the demands in developing a medical school. I have to learn new skills, and he said, well, gosh, the administration and fundraising and so forth. But I found this such an exciting and important challenge that I undertook that. So at any rate, we started there, and this really was a time that I worked closely with Hugh Gloucester. He didn't know anything about medical education, but he knew a lot about fundraising, a lot about conflict resolution, how to negotiate, et cetera. You know, the politics, as you know, in academic medicine, because we have politics, as you know. How do you really build a team, and how do you really work through difficult situations? So we had a great relationship here. So I started actually in September of 1975 here, and that led to a tremendous experience. So when I started here at Morehouse College, we were a special program within the college, and Hugh Gloucester and I worked well together. I started in double trailers on the campus. There was no space for the medical school. So they got these trailers as temporary space. And we really worked with Joe Gales and the team here, and I began to build a team. We got a grant, an $800,000 grant from the Bureau of Health Manpower to plan the development of this school. So we worked very, very hard in recruiting faculty, staff, et cetera, meeting with accreditation officials to learn what were the criteria that we needed to meet in order to be accredited. That was important because, of course, to receive federal funds, you have to have an accredited operation. So we worked hard, and we developed a plan to start as a 2-year medical school, but then to evolve from that into a 4-year school. By that, we meant that we would admit students and provide the first 2 years of education, which are primarily the basic sciences, lectures and laboratory exercises, and learning things such as physical diagnosis, how do you do a physical examination, how do you interview a patient, et cetera. But the last 2 years of medical school are primarily in the clinical field, working on the hospital wards or in clinics or in offices working with patients. So that was easier for Morehouse to really start as a 2-year school because we would have to develop clinical affiliations as well as a clinical faculty there. So that's how we started. So we were approved actually in April of 1978 to begin a 2-year program of medical education. So our first class enrolled at Morehouse in the fall of 1978, 24 students. And so we're very pleased. We had 14 men and 10 women. Among the things that, there were so many things we had to do. Of course, looking at a medical curriculum, deciding what would be the admissions criteria, establishing our tuition, establishing student financial aid programs, promotions and evaluation committees, all things that really, in a sense, were new to me as a medical faculty member. I'd been involved in them, but I was involved in ongoing operations, not setting them up. But that was very exciting, and we were very pleased that we were able to recruit a good core of faculty. And I found that you recruit people who are risk takers in those early years, people who were tenured faculty at places. They would not see this as something that they wanted to really risk, because of course the question was, would we be there next year, et cetera. Well, when we received our accreditation approval in April of '78, that was a major event. So we admitted our students there. And by this time, we had worked out contractual arrangements with 4 medical schools to take our students into the 3rd year there. That's because we wanted to, and this was a requirement of the accrediting committee, that we would have such arrangements that we could guarantee any student admitted to our program, if they did well academically, that they would really be accepted into the 3rd year elsewhere. Those contracts were with Emory School of Medicine, University of Alabama in Birmingham, Howard University in Washington, D.C., and the Medical College of Georgia in Augusta. So those 4 schools provided the contractual arrangements. So that helped us with our accreditation. In practice, when it came to first class transferring, they not only went to those schools, they went elsewhere. Brown, University of Illinois, and elsewhere, because the students could go anywhere. But the requirement of the accrediting committee was that any student admitted should really have an unimpeded path to the MD degree as long as they had satisfactory academic performance. So that's how we got started. And we had Paul Rogers, who was chairman of the Health Committee in the U.S. Congress, come down to be our keynote speaker when we opened in September of 1978. That we were very pleased with because, of course, he, among other members of Congress, were important in the funding of medical education, including new medical schools that were being developed all over the country. You recall that Mercer also started the medical school that admitted its first class 3 years later in 1981. Well, we had a very nice ceremony for that. Then 2 years later, in 1980, we broke ground for our first building. We had found land next to Morehouse College to build a medical school. We had also developed plans for the medical school in time to become independent from Morehouse College. There are a number of reasons for that. Among them was the fact that these questions about the wisdom of Morehouse College doing this were there, and the trustees of the college, while supportive, were also nervous here. Also, from my standpoint, I found being part of the college restrictive. I came here with a salary cut of $3,000 back then in 1975 because at the time at Boston University, my salary was $45,000. Now, in today's terms, that doesn't seem like a lot, but that was a pretty good salary back in 1975. Well, when I first told Hugh Gloucester what my current salary was, he almost fainted. So he said, we can't pay that. And so that started a long process. So I ended up coming here at $42,000. By that time, I was so committed to this that while that was really a little of a sacrifice and much more of an annoyance, I was really committed to this. So I came. So that was one thing. But also, the college faculty were concerned with all of the resources be drained off for the medical school and so forth. So because of those reasons, as well as the affiliation agreement of Atlanta University Center, that was another factor, because one of the things that happened was this: although Atlanta University trustees had voted in April '71 not to proceed and voiced no objection to Morehouse looking at this, when I was appointed dean, the vice chairman of the board of Atlanta University trustees, Grace Hamilton, who was a very powerful and important figure here in Atlanta in the black community, but also she was in the state legislature, she really objected to this thing. This was not something Morehouse College should be doing under the affiliation agreement. So I participated in a meeting of the trustees, of the executive committee of the trustees of Atlanta University and the executive committee of the trustees of Morehouse College in a discussion as to is Morehouse in violation of the Articles of Affiliation. And in that meeting, Hugh Gloucester pointed out this is what happened in April of '71. We raised the question, there was no objection. So on the basis of that, we proceeded here. The school is important. Morehouse College's intention is not to operate a medical school permanently, but to get the school started. It'll become independent in time. So there are all of these reasons, internal and external, for this to happen. So that's the plan that we developed. So in April of 1980, we had a groundbreaking ceremony for a new building. We would raise the funds, we would purchase the land, and we had Governor George Busby as a keynote speaker at that groundbreaking. So in '81, we became independent from Morehouse College, and that's when our name changed from School of Medicine at Morehouse College to Morehouse School of Medicine. In July of '82, we had the dedication of this new building. We had Don Keogh, president of Coca-Cola, who chaired our fundraising campaign for raising $2 million towards funding for this new building. And we had a $5 million federal grant also for the building. And so that was a happy time that we had. And I talk in my autobiography about what happened. Don Keogh came over for a luncheon that we were having for the members of the fundraising committee 2 weeks before the official dedication program for the building. And of course, Don arrived early. And I was, my office was about 10 minutes away. My facilities director called me and says, Don Keogh is here, he's early. And he's walking through the building. So I rushed over, but by the time I got there, he had been through the building. And he said, Louis, this is a nice building. I'm really pleased that we were really part of this. He says, but you know, there was a strange vending machine. One of these, I said, uh-oh. He said, it had PEPSI. Do you know what that is? So I was so embarrassed. I said, Don, I didn't know anything about this, but whatever, it'll be out of here before sundown. Well, I called my facilities director and says, what the hell is this? And so he hadn't paid any attention, but the contractor had this machine put in for his men to have access to this. But anyway, it was out of there. But during the luncheon, we had wine for the members of this committee, and we had a number of Atlanta businessmen who were part of this committee. When they poured the wine, Don said, may I see the label? The waiter had a white napkin holding the wine. Turns out it was Beringer Chardonnay. So Don came, turned to me and says, Louis, have you ever heard of Sterling Vineyards? I said, no. He says, Sterling is a nice vineyard out in the Napa Valley. Coca-Cola owns them. So he turned to his aide who was behind him, John White, says, John, get together with Dr. Sullivan. So next time he's going to be out in the California area, arrange a tour for him at the Sterling Vineyard. So I'm now so embarrassed. Here's a guy who's led the effort, raised $2 million for us. So 2 faux pas, that Pepsi machine, and now we had the wrong wine. But Don really, he was a good guy, and basically he was pulling my leg on both of these. But that was a bitter lesson at the time. At the dedication of that building 2 weeks later, we had Vice President George Bush as our speaker. And that's when I first met him. He had a great time afterwards. They had a great reception, and we in the library of the building, we hadn't yet moved into the building, and so here was Andy Young, was Ed McIntyre, the black mayor from Augusta, John Lewis, Joseph Lowry, all the other leaders in the black community here at this building, getting their pictures taken with this Republican vice president, et cetera. Well, Bush had a great time. He was supposed to stay 15 minutes. He ended up staying more than an hour. So the staff really ended up almost pulling him out. He had to get to New Orleans to give a talk that day. So as he left, one of his aides pressed something in my hand, so the vice president wants you to have these. Look at the pair of vice presidential cufflinks. 2 weeks later, I got a call from him on a Friday afternoon. I was about 3 o'clock in the afternoon. I'm working, trying to get some things finished before the weekend. So my secretary buzzed me and says, the vice president's on the line. I said, what vice president? She says, oh, how quickly we feel. I said, oh, that. So picked up the telephone. So he said, Lou, you know, I'm planning this trip to Africa in November. And if you'd be willing to do this, I'd like to have you go with me as a member of my delegation. So I said, well, gosh, Mr. Vice President, thank you. This would be quite an honor, but and I'll look at my schedule. I think I could be able to, but since I'm not in government, what would be my role being a member of your delegation? So he said, well, Lou, to be honest with you, we don't have an Andy Young in our administration because Andy had been so prominent in the Carter administration. And I don't feel I can go to sub-Saharan Africa without prominent African Americans as part of my delegation. So you'd do me a big favor, but more importantly, you'd do the country a service if you'd be willing to go to help represent our country. So I appreciated his honesty. So I went. And that November, Barbara was on that trip. That's when I met her. Visited 8 countries over a 2-week period. I'd learned about Barbara's interest in adult literacy because while Bush was meeting with the heads of state, she would be talking to some adult literacy group because it's the illiteracy in these African countries was really quite a problem. So on the way back, I talked with her. I said, you know, Barbara, you and I are in the same business, just different branches. You're in adult literacy education. I'm in medical education. we need to have you on our board. Would you be willing to? She says, Lou, I don't know about that. Everything I do these days have to pass through the White House counsel, and frequently they don't let me do things like this. But let me look at this and we'll see. Well, I thought, gee, what a sophisticated, nice brush off. Any rate, we got back to Andrews Air Force Base on Wednesday before Thanksgiving there in 1972. And I'm sorry, in 1982. And so the following Tuesday, she called me. She says, Lou, I can do it. So I said, that's great. So she was elected to our board, and she, in January of 83, so she came on our board and served for 6 years until 1989. During that time, she missed one meeting. She was a working trustee. She wasn't really simply a symbolic trustee. And she was worked very hard and was very helpful to us. For example, we had our first national fundraising campaign starting in early 1984. So she was our speaker. So we had luncheons in San Francisco, in Minneapolis, in Miami, and in New York, et cetera. We had a goal of $15 million, and we raised $18 million. Chairman of my campaign was Bob Frelke, who was one of our trustees. He had been Secretary of the Army under Nixon and Ford, and also a great friend of Mel Laird, who was Secretary of Defense while he was there. So that really helped us get off to a great start here. And the medical school, I was pleased with. We developed over the years. We received approval to operate all 4 years in 81, starting in 81. So the class that ended that year, which was the fourth class we admitted, stayed with us for the full 4 years. So the first MDs granted by Morehouse School of Medicine was April 1985. So that again was a great year. And so we were really doing well, enlarging the class size. We had an equal number of women as men. Among the things we had to do as we were developing our facilities on the campus of Morehouse College starting in 1978, we had to build laboratories for women. Morehouse College, of course, an all-male school. The only female laboratory was in the faculty lounge there on campus. So that was one of the things that we had to do. A number of other things that we did in developing the school, but we had high standards. I said, if we're developing this school, I want it to be a sound school. Students get a solid education, because I want people to know if a Morehouse graduate takes care of them, they could have full confidence. But then beyond that, I said, I want this to make a statement to the nation, because even today, there's always this question about, is the quality of black institutions really up to snuff? Are they as strong as white institutions? And I said, I mean for this school to have the same standards here. So we worked to bring in strong faculty, to have strong research programs as well as educational programs, and to see that on national examinations that students would do well. And it turned out they had high passing rate. 98, 99% of the students would pass on national board examinations, et cetera. So the school has really done well with its graduates, and we've also produced a high percentage of our graduates going into primary care. So for me personally, this again was a vindication of why I went into medicine in the first place. I'd gotten diverted and become an academician, but really in a larger sense, I was really helping contribute to the more black physicians and more diversity in the health professions. But when Barbara came on our board, that meant that Ginger and I were constantly being invited to events at the Vice President's home in Washington. One of my trustees had desperately wanted to be Secretary of Health and Human Services. And he had been a finalist in 1985, one of 3 finalists, but he didn't get it. But when Bush was running in 88, Monroe, my trustee, spoke with me and says, Lou, you know, I think Bush might win this. And, you know, I might have another shot at this. Would you be supportive? And I said, sure, I think you'd be a great secretary. He was the executive vice president for a pharmaceutical company, and I thought he would be a good president. He was an MD from Connecticut, active in Republican politics. So I spoke with Bush about this. Said, you know, This is one of my trustees. I think you've met him at one of the meetings of the executive committee that Barbara hosted there at your home. And he was a finalist in 1985 when Otis Boyne was chosen. But he's very good. So he said, well, fine, well, let me take a look at this. And if we should win this election and so forth. So, make a long story short, about a month before the election in '88, I was in New York, past a clothing shop called Aqua Scutum on Fifth Avenue. I spotted a red tie, blue tie, in the window with red elephants on it. So I bought it, and I sent it with a note to the vice president. I said, wear this on election day. It'll bring you good luck. And sure enough, when they were showing the election returns with him there, he was wearing that tie. So I called him the next morning after he'd been declared the winner. And I said, congratulations, Mr. President. I see you followed my advice with my tie. So that's great. I remember we talked about Monroe, who'd be a great secretary, well qualified. He said, oh yeah, Lou, I know. But you know, I was thinking, I need to talk with you about this. Would you be willing in about 2 weeks when things have settled down, would you be willing to come out to Washington? We need to talk about this. I said, sure. And I hung up, I said, what the hell do you mean by that? Does he mean, how do we talk about positioning Monroe? Or does he mean he wants to talk with me? I said, maybe I'm imagining things, but it sounds like he wants to talk to me. So sure enough, when I went up, that's when he said he wanted me to be secretary. Meanwhile, anticipating this possibility, I had spoken to my chairman of my board, and I said, I'm not sure about this, but you know, he said, well, let's just wait and see. So when that happened, I said, well, gosh, Mr. Vice President, I'd be honored, but let me think about this, and I'll get back to you. Among my major thoughts at the time were the following. One, I was solidly committed to what I was very happy with doing what I was doing, pleased with how the medical school was developing. B, there had been Monroe, who I thought would be a great secretary, because see, my plan was with Bush in the White House and with Monroe as secretary, I'd have complete access. Thirdly, I had never served in a government position. I'd have to uproot my family. Fortunately, my children were all off in college, or had graduated from college by this time. I talked with Ginger about this, and so she had said, well, let's wait and see what happens. The other concern I had was this. At that time, the Georgia legislature was still a Democratic organization. Tom Murphy was our speaker, and I developed a great relationship with him and with other members of the legislature. We'd gotten state support for the school, although the medical school is a private institution. We were given very good and generous state support. I didn't want to spoil that here, because this would have been devastating had we lost that support. So I went to see Tom Murphy. So I said to Mr. Speaker, I want to get your advice. You've been a great friend of Morehouse, et cetera, but our new incoming president wants me to serve as his Secretary of Health and Human Services, and I wanted to see, what did you think about that? We remember Tom Murphy was about 6'2", wore cowboy hats, cowboy buckles, and cowboy boots, and he chewed tobacco. So I asked him, he pulled this wad of Red Man tobacco out of his pocket and took out a pocket knife and cut off a wedge and stuck it in his cheek. Now, I think this took maybe total of maybe a minute and a half, but it seemed like a half hour. So he took a couple of chews and said, well, if our new president wants you to do that, Louis, I don't think you have any choice, because you don't turn down a president. He says, plus, so far as I'm concerned, it's not a dime's worth of difference between Bush and Dukakis. Anyway, that's how I learned he didn't like Dukakis. So he wasn't upset about Bush or about me going into it. So that was his way of blessing me. So I indeed, and I met with some other people too, but that was the most important thing, because Murphy had been in the legislature 24, 25 years at the time, and he was more powerful than the governor in terms of getting legislation through. So I went to Washington in 1989, and really, again, this was a new phase for me in my life. Ginger, of course, was very supportive, as she had always been supportive of me in my career moves here. But I was very much aware that this was a huge agency, because when he first met with me, Bush said, you know, I'd love to have you secretary, though I have to tell you in all fairness, this is a complicated department, and I'm wondering if I'm really doing you a favor or not, et cetera. But I was interested and committed to what the department was doing, and knowing that this department influences the lives of all Americans, I hear. So I went. And I met with, not only during my, prior to my confirmation, I went around and met with members of the Senate on my confirmation committee, as well as with the various health organizations like the American Hospital Association, the AMA, all these other organizations I'd be dealing with, et cetera. And the White House actually assigned a staff member to me to help navigate me through this. And also Alan Simpson, who was the Republican whip in the Senate, a close friend of Bush, also took me around to meet the members of the Senate, Arlen Specter, Jesse Helms, all these other people. So this was really quite an experience. But when I was confirmed, then we had a ceremony when President Bush came over with Barbara for my swearing in there at the department. That was a very nice event. And I then, over the next 3 months, worked very hard to get to know the programs in the department and get to know the people. And so I met with the senior leadership, about 300 people. And I said, I was very open. I said, you know, as well as this is my first time in a government position, large department. There's a lot that I have to learn, and you have the information and the expertise, and I want this to be a partnership, and I want you to share with me your concerns, your recommendations, your suggestions, because my door will always be open, because I want this department to succeed. And in order for that to occur, you and I need to work together. So I need to get the good news as well as the not so good news, and so you'll know that you'll always be welcome. The other thing I did, since my wife and I had started back around 1970, started walking every morning, primarily for fitness, to really help weight control. But we found that we loved doing this. So this had become quite a habit, you know, by 1989 when I went to Washington. So I told the members of my department, so I walk every morning, and if you want to join me for a walk, you're welcome. And as I go around the country visiting our 10 regional offices, I'll invite members there. So that gesture really worked a lot better than I even imagined, because I was telling the people in the department that I was approachable, that I didn't come in with a lot of fixed ideas about how I'm going to fix things, but really wanted to work with them. So during my time as secretary, I think I developed a very good relationship with the members of the department. I was very vigilant against smoking. I spoke out against tobacco use because of its fact that then and even today, #1 cause of preventable death in the country, not only cancer, but heart disease, stroke, other cancers, et cetera. I also worked to introduce a new food label so that people could know what's in the food that they are eating. That was a major challenge there as well. I initiated a minority male initiative, $100 million that we allocated to that over a 3-year period because of the problem of boys growing up without fathers in the home, and all the things that led to high school dropouts, violence, and et cetera. So there are a number of things that we did. And I was also committed to getting more diversity in the department, because when I went up to meet with the President-elect Bush in Washington, when he offered me the position, I said, well, Mr. President-elect, I'd be honored, but I'd like to know what your priorities are, and I'd like for you to know what some of the things are that I'd want to do. And I said, I'd want to have more minorities and more women in positions of leadership. He said, well, Lou, I support you on that. I'm all for that, et cetera. So I knew when I accepted the position that I would have his backing. So Among the things I was able to do, I appointed the first woman head of National Institutes of Health, Dr. Bernadine Healy from the Cleveland Clinic, the first female Surgeon General, Dr. Antonio Novello, who was at the NIH, the first black to head Social Security, black woman, Gwendolyn King, then the first black to head the Healthcare Financing Administration, Medicare and Medicaid. Now, the name is now CMS, Center for Medicare, Medicaid Services. And for various committees of the department, we had more than 250 programs in this department with a $600 billion budget. The time I left Morehouse, our budget was less than $100 million. So, of course, this was another leap up there. But basically what I found was the principles of management and leadership that I had at Morehouse really worked well at HHS also. That is, building a team, inviting people's ideas, and really giving them a chance to develop and supporting them too. So all of those things worked for me. So we did a number of things there when I was a secretary that I'm proud of. We actually pushed health promotion, disease prevention. I released the report called Healthy People 2000 in September of 1990, goals that we wanted to reach by the year 2000, such as people using seat belts in their cars. Then it was less than 50% of drivers were using seat belts. Well, now that's more than 90% of our drivers. So we said, oh, this is really a health issue, because if people don't use seat belts, their chances of being killed or badly injured are much greater there. So my time in Washington was another new kind of experience that I was the one black in Bush's cabinet there. And I also learned that Health and Human Services had the largest budget of any federal agency. Most people thought it was the Department of Defense, but my budget was $600 billion. Defense was $400 billion because we had not only all of the public health service, NIH, CDC, FDA, et cetera, but Social Security, Medicare, Medicaid, Head Start, all of these other programs, welfare, et cetera. So it's impossible to really manage all those programs. What you're doing is managing people, choosing good people, really supporting them, challenging them, holding them to high standards. But when they get into trouble, you support them. Then if there's a problem, if they're not really doing the things they should do, try and correct it. If indeed you can't do that, then in my view, you change people only when there's no other option. That is, you don't abandon people when trouble arises here. So overall, I had a great experience in Washington. Ginger also had a great experience because she was involved in so many things with spouses of other cabinet secretaries, international affairs, ambassadors, or other heads of state would visit, frequent receptions at the White House or at the German embassy or what have you. So for her, this was also a great experience. Among the perks there's a presidential box at the Kennedy Center, and of course the president wouldn't use that every night. So as members of the cabinet, on a first-come, first-served basis, we could have use of the president's box. So I would invite friends from Atlanta to come up for some symphony or some play or something at the Kennedy Center and use the president's box. So that was a lot of fun. So that was a great experience, and I feel good about what we did at the department. Still great friendships with the Bushes, and in fact, Ginger and I will be visiting them later up in Kennebuck, Maine. We keep in touch with them. And also the other members of the cabinet and members of my department, where I formed a lot of friendships there. But when Bush lost the election, which we were working very hard to get him reelected, we thought he'd be reelected because at the end of the first Gulf War, remember his ratings were 91, 92%. But that faded awfully fast because the economy, while improving, was really in a recession, and so he lost that. But when that happened, well, actually during '92, during the election, I got a call from Reverend Leon Sullivan, African-American minister, who is in Philadelphia. Leon Sullivan had been was first black elected to the board of General Motors. And of course, he was the one who advocated for U.S. companies divesting in South Africa because of the apartheid principles. Well, I knew Leon Sullivan. I'd served on his foundation before I went into Washington. So he called me I think it was in June or July of '92. He says, where are you going? I said, what are you talking about? What are you going to do? And I said, well, right now I'm working to help get President Bush reelected. He said, so you're going to stay? I said, well, that's my intention. They said, well, okay, but if you change your mind, etc., if you decide you're leaving, the first call you make, you call me. I said, well, okay, Leon, fine. I had no idea what he was talking about. Well, the election came and Bush lost. Leon Sullivan called, Lou, I want to come in and see you. I said, fine. I want to bring Jack Smith with me. I said, who's Jack Smith? He's the new CEO of General Motors. I want to bring him with me. I want to talk to you. So about a month later, he came in and actually brought John Smale, who was the non-executive chairman. So they recruited me to serve on the board of General Motors. I accepted. So when I left Washington in January 20th of 1993, I went on the GM board. By that time, several other companies had approached me too. So I went on the board of 3M, Bristol Myers, Squibb, Equifax here in Atlanta, and also then Georgia Pacific, and a couple of other companies, Household International here. But I came back to Morehouse School of Medicine because the fellow who had succeeded me, Jim Goodman, as president, had decided in the summer of '92 that he wanted to move to Seattle. So he stepped down as president. We had an interim president appointed, Nelson McGee. And so the trustees of the college approached me, similar to Leon Sullivan. But I said, well, gee, I can't make any commitment. I'm working for Bush's reelection. And if he's reelected, I don't know what his plans are, but I don't want to be incumbent, because if he asked me to stay on, I'd be willing to do that maybe for another year, year and a half so into his new administration. So I think you ought to proceed with the search. Well, when Bush lost, I got a call again from Jim Hayes, who was the chairman of the board of trustees of the medical school. So I came back to Morehouse. I was pleased to come back, like returning home. So I came back and, of course, and served until the year 2002. By this time, the school was doing well. We'd gotten the maximum 8 years of accreditation, the maximum we could get. So I thought that really it's time for new leadership. So I announced that I would be stepping down as soon as we recruited a new president here. But I thought that really it was time for that turnover. So the things at the medical school that I'm most proud of are what our graduates have done. I think that is the most significant measure of any institution. What do its graduates do, et cetera. We've had, although the school is still young, it's now some 35 years old, we've had a Surgeon General. It's one of our graduates, Regina Benjamin, who served until just a few months ago. Then the president of another medical school, Wayne Riley, became president of Mary College of Medicine. We've had a large percentage of our students who've gone into primary care, that is the family medicine, pediatrics, or general internal medicine, and have settled in medically underserved areas in rural communities in Georgia and elsewhere, and some inner city communities as well. So I feel that the school is addressing its mission. We also have a faculty that's been successful in competing for NIH research grants. We've established a Neuroscience Institute, the first such institute at a black school in the country, Cardiovascular Research Institute, and the head of that institute was recruited about a year and a half ago to be the director of the National Institute for Heart, Lung, and Blood Diseases at NIH, a premier research agency in the country. So I feel that we as a young school are doing well and have done well. And for me, the important thing is have an institution that's relevant to the community, that's contributing to the community. Because what I say is this: during the span of my life, I've gone from growing up in a rigidly segregated, repressive environment to now an open, supportive environment. First of all, that happened when I went to Boston, but when I came back to Atlanta 21 years later, the environment has changed. because I was supported not only by black physicians, but by white physicians and by others in the community. And so I say that the story of my life and the Morehouse School of Medicine is one of significant social change that made these things possible. And now, in turn, Morehouse School of Medicine, with its activities and with its graduates, and by the way, we've always been an integrated institution. Although we're predominantly black, we've had white students from the beginning. I think we had 6 white students in our first class. We had students who had grown up in Pakistan, in Tanzania, et cetera. So while our focus has been increasing percentage of black physicians, really having an integrated student body and an integrated faculty as well. So in a sense, what pleases me and what I'm proud of is Morehouse School of Medicine, having been developed under the circumstances that it developed, is now contributing to improving our society here in Atlanta and in Georgia and really around the country. The other thing I would say is I was very lucky in really the woman I was able to convince to marry me, Ginger, because she really has been the center of gravity for our family, because I'm sure it wouldn't surprise you to say with all these things I've been involved in, I was constantly on a plane going someplace. So she was the one who really was there for me as well as for our 3 children. And so she's always supported me regardless of what it was, because she hadn't thought of moving to the South or becoming wife of a dean of a medical school or taking a risk like that, because I really had, I had a pretty safe career by the time I became professor of medicine at Boston University. I knew the field. My goal at the time was to become chairman of a department of medicine by age 45. Well, at age 41, I came back here as a founding dean of a new medical school. But through all of this, she's been supportive. For example, she formed here at Morehouse School of Medicine a support group called the Friends of the Morehouse School of Medicine. They would have an annual dinner and other activities throughout the year to raise funds for scholarships for our students. She did this totally as a volunteer here and helping me with the school. So she has been great, and I'm proud of my 3 children because, as I mentioned, my oldest son, Paul, is a physician himself, radiologist in Dallas. And we have two grandsons now, 10 and 11 and a half, that he's given us. His wife, Laura, is a pharmacist as well. Then my daughter, Shanta, who's my apple of my eye. Of course, she's an actress living in Los Angeles, and so she's very active with her various career possibilities there. And then my son, Halstead, who actually finished Westminster School here, and then went on to University of Virginia, then to Harvard Law School. But he decided before graduating from law school, he really didn't want to practice law. So when he told us that, he surprised us. He said he wanted to become a comedian. So that was a real surprise. Well, he ended up becoming a comedy writer, so he became one of the co-producers of this television show, The Office, which really had a run of a number of years that just last May, just a year ago, closed. But he's now written some other television shows that he's negotiating to getting them produced. So my children have done well, and so it's really been rewarding for me in my career. And my brother is still alive, a year and a half older, and we have a great relationship here. He actually, I was able to recruit him to join me at the medical school back in the early 80s to become the director of our federal programs, because he's a chemist by training. He got a PhD in physical organic chemistry from Ohio State and worked at Raman Haas Chemicals, and then became chairman of chemistry down at A&T College in North Carolina, and was served as dean at Fort Valley State University for a time. But then in the early 80s, I recruited him to become director of our federal programs at Morehouse, and he's retired from that, but he's still active there. So overall, I'm pleased with my career. The only regret I have is everything that I've done, I've enjoyed. Whether I was teaching students, doing research, taking care of patients, love to take care of patients, see people improve, dealing with diagnostic issues, etc. But then becoming an administrator, what I really had thought would not be something I was interested in, I really enjoyed that, developing an institution. I feel that I've developed an institution that hopefully will be around 100 years, 200 years from now here. So in a sense, I've been lucky, and I had good mentors all along who really inspired me to stretch, to really take risks, to really try and make a difference. And I found that fulfilling. People have often said, well, you're a workaholic. I said, it's only work if you're not enjoying it. And I'm enjoying what I'm doing. And as long as I get that's feedback to me. That's really my payoff. So that's it. And I feel that all along, starting with my parents, I just had the right kind of support and advice, and I took advantage of that. And now I hope to pass some of that on to the next generation. When I started with medical school at Morehouse, being a hematologist, I thought I could do hematology consultations because I enjoyed seeing patients and thought I could be helpful there. Well, after a few months, it was clear to me that wasn't going to work. And I said, well, you know, my value to this institution is not as a hematologist. It's really developing the institution, the plans, recruiting the faculty, developing the curriculum, getting it accredited, raising the funds. These are things that only I can do. We can get other people to do hematology, and as much as I enjoy it and its personal fulfillment, that the time I spend in hematology is time I'm taking away from these other things. So my regret was I couldn't be involved in teaching students or taking care of patients or doing research and raising funds and cultivating donors, meeting with architects and so forth, because of course building an institution, a lot of things ranging from buying the land, getting permits to take trees down, which I learned in Atlanta is not the easiest thing. and I'm pleased with that. But as you know, the city is committed to that. So there are just so many things. But I found the central thing for me was building a team within the institution with the faculty and staff, et cetera, committed to the institution, building a team of supporters outside the institution, because any institution that's viable and important really depends upon a lot of people in the community and around the country who support what you're doing, whether they are giving funds or whether they are helping with legislation that's important to you. So that's where I felt that was my value added. That was something that I needed, that I had to do. And so things that took away from that, as much as I enjoyed them personally, I knew that was not really the thing that's going to be building an institution. So that's what I meant by that. I regretted the fact that I couldn't do it all, but at the same time I realized that that was not a rational thing to expect that I could do all of those things simultaneously. Oh, Don Keogh had a great impact on our institution and on me. First of all, as you know, Coca-Cola is a leading institution, company here in Atlanta and really around the country. And so they are a corporation that really has a very strong corporate responsibility culture. So having Don as our leader of that fundraising effort really meant not only what he could bring in terms of funds to the table, but the endorsement of the business community. So that helped legitimize this new untested organization there. So there's no question that Don Keogh and the Coca-Cola Company and also the Woodruff Foundation over in the philanthropic side were important, because I describe in my autobiography my first meeting with Beaufort Jones, who was then president of the Woodruff Foundation. The Woodruff Foundation is a very important, very solid foundation, but they tend not to be the initiator of things. They will support you once you've established and shown that you are a viable, ongoing organization. So that was my experience there. So my first introduction to Beaufort Jones was to welcome me to Atlanta and wish me well, but also say, you should know that we have one medical school we're supporting. That takes almost everything we have and then more. So I hope you know that you can't count on us for support. I said, oh my goodness. Well, turns out our first piece of land back in 1978, 77 actually, was purchased with a $250,000 grant from the Woodruff Foundation, because by that time we had shown that this was a serious effort, this was a quality effort, so they then supported us, and then they've been supportive of Morehouse since that time. So I had to learn all of these things and had to establish our bona fides there in the corporate world as well as in the philanthropic world and in the academic world. President Bush was really quite a guy. Actually, his public picture that most people have really is so different from him in private. Yeah, he wears these red socks or argyle socks or things with funny stripes, cowboy boots, etc. And he has a great sense of humor. And what was frustrating to me and my fellow members of the cabinet was just the television cameras. He was never comfortable with them. We would be sitting around the cabinet room before starting a cabinet meeting, joking, etc. And then Marlon Fitzwater, our press secretary, saying, okay, photographers, that means they're going to bring in the photographers. So a shade had been drawn down over him. He was stiff, not comfortable, not smiling, and so not eloquent. So that was frustrating to us because this was a different person from the one we knew. But no, he has a great sense of humor, enjoys life, and as you know, just jumped out of a plane over his 90th birthday. I sent him an email saying, congratulations on your successful jump. I'm pleased that it went so well. And so he sent back a message saying, thanks, Lou. I know a lot of people think I'm nuts, but I'm planning on doing this again when I'm 100. So yeah, he's quite a guy. We got to be very good friends. I also learned when he was a student at Yale, he was a student leader of the annual United Negro College Fund effort, racing funds. And he formed friendship with Dr. Trent, who was the founder of the UNCF. And he and his family have been very supportive of higher education in general, including black higher education, because I'm pretty sure this still occurs over the medical school, but every year, early December, we get a check unsolicited from his personal check, contribution to the medical school. And of course, Barbara was a hard-working trustee on our board there. On that trip to Africa, there were 3 African Americans, Art Fletcher, who had been Secretary of Labor under Nixon, and Benjamin Payton, who was president of Tuskegee University. He had spoken, this was now in November of '82, a year before, in October of '81, he had spoken at Ben Payton's inauguration as president at Tuskegee. And of course had spoken at the dedication of our building in July of '82. So, and there's the other thing that most people don't know, and I talked with him about this during the campaign when things are really starting to look a little dicey. His mother was one of the founding directors of the United Negro College Fund when they were founded in the late 40s. But not only that, since then, continuously to this day, a member of the Bush family has been on the board of the UNCF. The current member is Jonathan Bush in Boston, who is head of a company, I'm trying to remember the name of it, but they are a data collection services company. They support NPR. You hear them announced there. So things like that, you know, when things weren't looking, I went to him and said, Mr. President, you got to let people know the things that you're doing. I says, in the black community, education is so important. They don't know that your mother was one of the founding directors of the UNCF, or that you know, you're members of the Bush family. And he said, Lou, I don't do this for political reasons. I'm not going to do that. I said, well, look, I know you don't do it for political reasons, but what people want to know is, what are your values? What do you stand for? That's important to people. I could never get him to do it, So anyway, we're good friends, and we see them usually a couple of times a year. And so we'll be visiting them. I think it's August 27th. We're going up to have lunch with them up at Kennebunkport. But he's quite a guy, and Barbara is quite a gal too. She really is quite a personality. Edward Moulthrop had another career. I think he was he was an architect at Georgia Tech, but he developed this technique for carving wooden bowls, beautiful wooden bowls. And if they have them at the Atlanta History Center. They also have them one at the Woodruff Art Center. And these are all woods with trees that grow in Georgia. So Ed Moulthrop developed this, and Ed died maybe 8 or 9 years ago. Philip Moulthrop, his son, was a lawyer, wasn't interested in this growing up, but he became but he started himself, I think, in his late 20s. So he's developed these bowls. So these bowls are now in the collections at the Museum of Modern Art in New York, in the Smithsonian. They have them in the White House collection. They sell them out at Gump's in San Francisco. And the signature galleries here up on West Peachtree also sell them. Well, make a long story short, they are really among the most talented of wood carvers around the country. They have a coffee table book of them called Moulthrop Bowls. When we went up there to visit the Bushes about 2 years ago, I took two books, because actually for these fundraising campaigns and other things, we would give to the campaign leadership these beautiful carved bowls as a thank you, really beautiful things. So I went up with an offer from Philip Moulthrop and his son. I don't know why I'm blanking out on the son's name, because Philip himself is now maybe about 60, and his son, I think, is about 35 or so. So he's now, the son is the third generation. Took up that they wanted to contribute a bowl from each Philip and his son to each of the Bush libraries. So I went up with this message, and President Bush, when Bush 41 was there, but W wasn't in Maine yet. He has a home just about less than half a mile away from from Walker's Point, which is the home that President Bush has. So at lunch, I mentioned this. So Barbara said, "That's great, we accept." So she accepted on behalf of both the libraries there, right? So no, they're the great people, and really. And I also should have mentioned, when he was running for the presidency in June in '88. In June of '88, we had a reception here at my home for him. He couldn't come down because he had an event elsewhere, but Barbara came down. And the purpose of that was to introduce him to the black community, because you probably know that the black community didn't view the Reagan administration as really very sympathetic towards their concerns. And so a lot of people in the black community just considered Bush as a clone of Reagan, and I felt differently. So I told him, I'd like to have a reception to introduce you to the black community here in Atlanta. And that community is important because we have friends all over the country. Because see, when Jimmy Carter was running for president, you may remember the Peanut Brigade. I was still in Boston at the time. They went all over the country telling the black community, this peanut farmer, he's a great guy, and he's interested and supportive of our issues, and so forth. So I wanted to generate some of that kind of support for Bush here. But he is really a great person, very strongly interested in education. Even his son, you remember Jeb Bush, strongly interested in education. And W, he developed this education plan, No Child Left Behind. Of course, a controversy about that, but the fact is, interested in education. And W also established PEPFAR, the President's Emergency Funds for AIDS relief in Africa, et cetera. So there's a very strong humanitarian value system that they have. Early in my tenure in 1989, I went with him on Marine One, the helicopter. He went over to Baltimore, where he spoke at the centennial celebration of Johns Hopkins University where he spoke. And on the way back, which was around 12 o'clock or so, he said, well, what are your plans this afternoon? I said, well, I'm going at 2 o'clock. We're swearing in our new HICFA administrator, Medicare, Medicaid, Gail Walensky. He says, really? What's her name? Gail. How do you spell Gail? Well, next thing I knew, he had whipped out his notepads and wrote, say, hi, Gail. Congratulations on becoming HICFA administrator. Great to have you on our team. Good luck to you, George Bush. So 2 hours later, I was presenting this to Gail at the swearing in, and that was something. So he was always doing things, like that. Another time when there were the Los Angeles riots, I went with him there. And there were, I think, some firemen or policemen who had been injured during some of those riots. He went to the hospital to visit with them, and he sat and he stayed there. He must have stayed there maybe 20 or 25 minutes, talking with them, et cetera. But the other thing that happened, too, that we knew that this got to him, and really the rest of us almost choked up. In January, I guess it was January of '09, when W was in the end of his tenure, they had the dedication of the aircraft carrier, George H.W. Bush in Norfolk. So Ginger and I were up for that. Quite a glorious ceremony with this this huge city floating on a ship, etc. But they had, at the end of the ceremony, which I guess was not quite an hour, they had this flyover of these precision flyers there, and after they flew over, trailing them was this World War II dive bomber that he had been shot down in as a salute to him. So everybody choked up, then, including him. Yeah. But no, he's quite a guy. Yeah.